Good morning, everyone. Happy Sunday. We're back again for another hour of exciting medical news, world health news with Dr. Samadi. I'm the chair of urology at Lenox Hospital. We had a very productive week. I took care of a lot of patients with prostate cancer and our robotic surgical skills. And we're here to bring you the latest news, and we have a very exciting program for you. We have Dr. Misalek with us. We have Mr. Paul Howard, who's going to talk about a little bit about Medicare and changes in Medicare. And I also have the latest health news for you, which is what I'd like to bring in and tell you what's going on so you stay healthy. I also get a lot of emails and texts and on Facebook and Twitter about our music. So if you have songs that you like, this is becoming a whole family program, and I know a lot of people love to dance, and it's a Sunday morning, not only learn, but also it's not a boring show. It's exciting, and we're here for you. If you have questions, medical questions, comments, feel free to call 877-970-2999, and we're here for you. One of the biggest medical news that really took all the media this week was the fact that FDA put up a very strong warning about all the non-steroidal medications. And I'm talking about Advil, Motrin, ibuprofen, and Aleve. And if you're taking these medications for a long period, I'm not talking about if you have arthritis and once in a while you take this medication once a month or so. That's not what we're talking about. We're talking about people who really take this at a high dose on a long period of time. You are at risk of heart attack and stroke. What's interesting is that the FDA actually made an announcement in 2005, and at that time, as part of the label of all these medications, it basically said that it may cause increased risk of heart disease and stroke. But now recently, this week, they basically came up with the fact that there's a stronger evidence based on more data and more studies out there that it can increase the risk of heart failure. People that are taking these NSAIDs, over-the-counter medications, you have to be very careful, especially if you have a history of heart disease, if you have a heart attack. Don't just take these medications on your own, and this is the biggest news this week. The idea and the cause is still not 100% well known, but perhaps it changes some of the hormones on kidneys. It allows more absorption of salt and more absorption of water, which can cause to high blood pressure. And high blood pressure obviously is a risk factor for heart disease. So big message to the people that are taking these medications for a long period. But Dr. Samadi, you said I need to lose weight, I need to exercise, and as I exercise more, I'm going to have more knee pain and arm pain and leg pain, etc. And I need to take these medications to be able to do that. Well, the way to do this is to really try to change your diet, lose the weight, exercise with a non-weight-bearing exercises like swimming, like biking, like other things that's not going to put too much pressure on your knee. And don't run to the pharmacy and take these over-the-counter medications. As I mentioned, Motrin, Advil, ibuprofen, and Aleve. I would be very careful, and it's a word of caution out there about this. If you want to try Tylenol once in a while, I think it's perfectly fine, but Tylenol has its own problem.